This conference will now be recorded.
Good morning, everyone. I'm Sundeep, and I'm going to take a class on how to manage the snake bites. Usually, snake bites or even another poisonings, you'll get one question, and this is one of the important questions for you. And I'm going to deal with it and just concentrate on it. What are the symptoms of the snake bite, and how to handle a case of a snake bite, and how to rescue the patient. You just keep concentrating on those ones. It is regarding some snakes and where they are available. Usually in rice fields, vipers and cobras are available, and rubber and coffee plantations, pit vipers are available. And the bites in which a venomous snake's fangs pierce the pierce the skin, but no envenoming results are known as dry bites. And the clinical symptoms, it is very important what happens at the site of the snake bite. That is a local envenoming. There is increased localized pain at the site of bite. The crate bites are usually painless, but usually there is localized pain at the site of bite, and there will be painful swelling of regional lymph nodes draining that bite site. Sometimes fang marks may be present, persistent local bleeding, bruising, and lymphangitis, inflammation, swelling, redness, and heat. The blistering, blood, bullae, vesicles, infection, abscess formation, and necrosis may occur. Yes, some visuals you can see that. It can happen because of the envenomation of the localized site. You can see the two fang marks there at the picture A, and B, the bleeding you can see. C, you can see the bullae and the blistering happening all around because of the local envenomation. These things can happen when there is severe snake bite, and we don't take necessary measures. And as a poison, as a venom, starts draining towards the systemic circulation, that is towards the heart, and that is towards the liver. And as the venom starts moving from the site of bite to the other organs, the systemic manifestation starts to occur. And these are some systemic manifestations. The patients can experience some nausea and vomiting, the malaise, abdominal pain, and weakness, drowsiness, and prostration. I will classify the symptoms into neurologic and hematological afterwards. These are the common symptoms that's going to happen during the snake bite. Cardiovascular, coagulation, neurological AK, and I will deal with it in the coming slides. These are the cardiovascular symptoms. Dizziness, shock, hypotension, cardiac arrhythmias, and myocardial damage may occur. Myocardial damage refers to the heart failure. There is generalized increase in capillary permeability. There is facial, periorbital, conjunctival edema, and the pleural pericardial effusions, and the pulmonary edema. Usually, the patients presenting to casualty after a snake bite may present with hypotension, and some patients might have cardiac arrhythmias. When you take ECG, you find some tachyarrhythmias usually, and you must know that there is a snake bite and that cardiovascular damage happening, and you must treat accordingly, and I will tell you that later. And the bleeding and clotting abnormalities, localized traumatic bleeding from the recent and partly healed wounds and venipuncture sites. There may be spontaneous systemic bleeding, as you have seen in the previous slide, from the bite wounds, and also from the other capillary membranes, like that in the mouth. For example, from that of the nose, there can be spontaneous systemic bleeding. There may be gums, epistaxis, hematemesis, and hemoptysis may also occur. Meningism from subarachnoid hemorrhage can occur. That is very rare. Rectal bleeding and marina very rare. But you must know that there may be spontaneous bleeding from the mucocutaneous sites, and also there can be rarely subarachnoid hemorrhage, and the bleeding that passes on to the stools and may occur in melena also. This is some of the slides of hemorrhagic, hemorrhages. That's a part of the one rare snake bites. You can see that the subconjunctival hemorrhage in Russell's viper, but these are quite rare. Neurological, there can be bilateral ptosis. This is very common. Usually the patients present with bilateral ptosis, the patient seems to be closing the eyes, but that's not the case. It's a case of bilateral ptosis, and you must treat very fast, not to for the to serve to stop the progression of the venom. And there is a bilateral ptosis. The patient usually comes to the casualty with a closure of the eyes, and you have mistaken it for even coma, but it's not. But that's not the case. And there can be external ophthalmoplegia. I mean, the patient may have, the gaze abnormalities. The patient can be staring at something. The patient can have sometimes nystagmus, and sometimes the patient's one eye is kept abducted. So you must know that when any eye abnormalities or any ptosis, you must be able to understand that the patient is already there is systemic envenomation has already occurred. And there is of course also descending paralysis progressing to generalized flaccid paralysis, and it is in the late conditions when you don't treat at the appropriate time, when the patient runs with ptosis and external ophthalmoplegia, then the patient can land up in paralysis. Yeah, this you can see the patient so usually present like this. You may think that he's taken some toxin. Sometimes if the fang marks are not found or the history is not clear, you might get mistaken for that, but that's not the case. Acute kidney injury can occur. It is manifested by the low in pain, hematuria, and hemoglobinuria. Myoglobinuria can also occur, and uremia, acidotic breathing. And usually the patient ends up in acidosis. There can be generalized rhabdomyolysis. When the muscles are stiff, tender, painful, or passive stretching, trismus. Sometimes trismus can also occur. The patient unable to open the mouth and unable to respond, even though sometimes he may respond, but he unable to open the mouth because of the muscle stiffness. Because of the stiffness of the muscles of mastication, it happens, and because of the rhabdomyolysis, there can be a dark brown urine, and it can be one of the causes of the acute kidney injury. There is it's a term called cobra spit ophthalmia. This is immediate intense pain, profuse watering with white discharge, congested conjunctiva, and spasm and the swelling of the eyelids. This happens with especially with the cobra bites when there is a severe congestion of the eyes, and it leads to the swelling of the eyes. You may think that it's because of any external trauma, but that's not the case. The management includes irrigation of the affected eyes and other mucous membranes with liberal quantities of water, and the medical treatment involves analgesia and exclusion of the corneal abrasions and application of prophylactic topical antibiotics. And acute pituitary insufficiency, Russell's viper. Usually acute pituitary insufficiency occurs with the Russell's viper. There you can see sometimes hypoglycemia occurs because of the lack of ACTH, and chronic loss of secondary sexual hair, loss of libido, amenorrhea, testicular atrophy, and hypothyroidism. Sometimes it can also occur, but this is not that usual. As you can see, one patient presenting with symptoms is a pan-hypopituitarism 3 years after severe envenoming by Russell's viper. But this is not an acute condition. Even acute pituitary insufficiency can occur, but this happens quite late after the snake bites. And the long-term complications at the site of bite are the tissue loss. Sometimes the patient, because of the gangrene, the limb needs to be amputated. This is a long-term complications. Chronic ulceration might occur, infection, osteomyelitis, arthritis, and this can occur. Chronic kidney disease, as I already said, pan-hypopituitarism, neurological deficits. As you can say, the patient may land up in paralysis, and it takes very long time to recover. And depression, anxiety can occur sometimes because of the amputation and chronic ulceration like that. And coming to the management, the management is divided into some things, because it's not a straightforward give this drug and it will be healed. It's not like that. There is a first rate treatment. First, you need to handle the patient very well during his his transport to the hospital. If you find him in the spot of the bite, you have to take certain measures to prevent the venom from going into systemic circulation. And of course, you have to hospital treatment, and what are the investigations and how to follow preventing the further complications of the snake bite. First aid first comes, and it include first things, you must know what should not be done. There's always misconceptions around the treatment of snake bite. You have to make local incision and take the poison out as much as possible. In fact, it making local incisions or pricks or punctures leads to much more faster transport of venom to the systemic circulation, because any incision, it damages the capillary system there, and the venom moves fast through the capillaries into the veins, and the venom can travel very fast, and that should be avoided. And the local incisions and pricks and punctures at the site of bite must be avoided. Attempts to suck the venom out of the wound, as you can see in some of the films, they take the venom out of the wound in a whole films, but that's not the case. You should not do it, because it might even harm the patient who is taking out the venom. And sometimes the bites of the teeth can even, as I said earlier, leads to faster transfer of venom into the systemic circulation. Tying tight bands, you should tie it, but you should not tie tightly, because if you tie tightly, the normal circulation, the normal venous circulation gets stopped and gets abrupted, and it may lead to even gangrene sometimes. So tight bands must be avoided. And sometimes ice bags, and some people give electric shocks and all that. These things should not be done. Reassure the victim, who may be very anxious and will drive away the fear and slow the patient's heart rate and reduce spread of venom. You should assure the patient to prevent the sympathetic complications. How to do the pressure immobilization? Apply pressure pad immobilization. You don't confuse between pressure immobilization and, as I said earlier, don't tie tonic beds tightly. There is a world of difference between the two. If you take a tonic bed and tie, suppose at the level of knee, and the blood circulation stops below the knee, and it stops going upwards, leads to the stasis of the blood, and ultimately leads to gangrene. That's the different thing. Yet the pressure immobilization means, if if there is sufficient equipment available there, then you do that the pressure bandage immobilization, as you can see in the pictures, or if just apply the pressure pad method has proven effective in reducing the spread of venom. Just apply anything, the cloth around with just a minimum pressure. That's what all I need to say, a minimum pressure, and immobilize it. Don't mobilize the limb, because if you keep on mobilizing, then there may be chance of faster spread of venom. So don't immobilize the limb. Don't mobilize the limb. And if the patient has already applied very popular methods of first aid, they should not be released until the patient is under the medical care in hospital. As you can see, the gangrene is limb there because of the tight bandage. You shouldn't be doing that. If the tourniquet is already tied, you must release it in the hospital only. You should not, you don't take the medicine to your hands. And the examination of the beaten part, you should examine how the extent of the tenderness and the lymph nodes and all that. And you should generally check the spread of venom to the various parts, like if there is any cardiovascular involvement is there or not, or if there is any neurological involvement. You should check a general examination. As I said earlier, the eyes you have to check. There may be congenital congestion, the paralysis, as I earlier said, ptosis, or come to cardiovascular blood pressure. You check all these things. According to that, you can even figure out what is the snake that is bitten. Of course, it doesn't matter. We given the polyvalent anti-snake venom, but you will get an idea. To exclude early neurological envenoming, ask the patient to look up and observe whether the upper lid retracts fully. Ask about the diplopia, and diplopia, that is a double vision, and the test eye movements for the evidence of early external ophthalmoplegia. As I said earlier, you already know the abduction, adduction, lateral rotation and the medial rotation of the eye. You must check whether he's moving the eye in all directions or not to check for action of ophthalmoplegia. If he's not able to do it, then you must act immediately, as there is already a spread of venom. And you have to check the size and the reactions of the pupil, and ask the patient to open the as you check the trismus. And sometimes the patient, as I said earlier, may present to you like a trauma patient. As you can see, broken neck. It's like a broken neck, but it isn't the case. It's because of the uh, weakness of the neck muscles there. As I said earlier, don't come to as because of their unconsciousness, or even related peoples don't think that it is uh, that is a case of brain dead, or the patient just are unresponsive. That's it. And the investigations, 20-minute whole blood clotting test. This is very important that you must do to every snake bite patient. As you have to answer this to even in your exams or even in your viva, or if this question is given, this point must be written in your answer sheet if it's a theory question. This is a basic thing, and everyone must answer if this question is asked, or write if this question is given. It is 20-minute whole blood clotting test. You know, from every patient of a snake bite, place 2 milliliters of freshly sampled venous blood in a small new dry glass vessel. Leave undisturbed uh, for 20 minutes at ambient temperature. If the vessel if the blood is still liquid and runs out, the patient has hypofibrinogenemia, incoagulable blood, and as a result of venom-induced consumption coagulopathy. Usually the blood gets clotted, but even if after the 20 minutes, if the blood isn't clotted, usually the blood, as you know, the clotting time is just 8 minutes, and clotting time is just 4 minutes. And if it exceeds, usually you check for 20 minutes. Even if even after 20 minutes the blood is still in a liquid form, that there is you can come to conclusion that the patient is having the systemic spread, and usually the blood is getting contaminated with the the blood got spread with venom already. You must give anti-snake venom immediately then. But remember this 20-minute whole blood clotting test. You have to understand this. Just take the blood in a vessel, leave it for 20 minutes, and after 20 minutes, if it doesn't blood clots, then the patient is affected with the venom. You must give anti-snake venom immediately. Positive results indicates severe consumptive coagulopathy and need for immediate, as I already said. False positive results then sometime occur, but you remember the basic thing. And you must also check the international normalized ratio INR. As you go on to the internship, you always keep finding for most of the patients, there will be PT and INR, prothrombin time and INR usually will be checked. And FDG, fibrin degradation products or D-dimer, you must know, as you already do this for the pulmonary embolism, and you have to check whether there are any blood clottings and all that, thrombocytes, peripheral smear, all these things you have to do it. Urine examination is also, as I said earlier, there will be AKI, and also there will be hemoglobinuria, and you have to check the urine as well. And these are all the other investigations that needs to be done to a snakebite patient. You have to check the electrolytes. You have to check, the liver function test, whether which organ got infected. You have to know if this is a liver, if it is a renal, and you have to treat accordingly. Even though it is symptomatic, you must know which organ is getting affected, whether it is neurological or whether it is hematological. So these investigations must be done. As I said earlier, echocardiography for cardiovascular dysfunction, usually to know the heart failure, ultrasound, and all these things. CT and MRI, sometimes hemorrhage can occur, so you have to do that if there is any symptoms of that. So coming to the treatment, anti-venom. It is the only specific antidote to snake venom, and usually in India we give only polyvalent anti-snake venom serum, ASV it is called. So is raised against venom of the four species. Those are cobra, great Russell's viper, and saw-scale viper. You must know for which snakes these venoms will work, and you must know these four names, that is cobra, creatine, viper. And what are its indications? Antivenom treatment is indicated if when patients with proven or suspected snake bite develop one or more of the following signs. You know, if there is any local swelling involving more than half within limb within 48 hours of the bite, if there is rapid extension of swelling beyond wrist, ankle, or enlarged lymph node, if there is any, as I said earlier, if there is a positive 20-minute blood clotting test, you have to know that you have to give it immediately. And there's coagulopathy means if there is any discrepancies in the INR, that is, if the INR value rises, then normal. You have to usually give. If you're in a dilemma whether to give the anti-snake venom or not, if you're not sure, then it's better to give anti-snake venom for minimum dose as well. If you're not if you're not sure whether to give it or not, but if these symptoms are present, you have to give it immediately as soon as possible. If there is neurotoxicity, as I already mentioned, if there is any cardiovascular abnormalities, acute kidney injury, and intravascular hemolysis and generalized rhabdomyolysis, you must immediately give the anti-snake venom. How to give that? You have to give either by slow push injection or by intravenous infusion, diluted in 5 ml per kg body weight isotonic fluid over 30 to 50 minutes. That means you have to give, for example, if it is a 60 kg, then you have to give 300 ml of anti-snake venom over 30 to 60 minutes. It is have to be given as 5 ml per kg body weight. Usually, in a hospital, we give in normal saline, dilute the ASV in normal saline. It should be given as soon as it is indicated and as long as the anti-hemostatic abnormalities persist, even 2 weeks after the bite. You have to give it if there is a positive 20-minute blood clotting test. You have to keep giving until it becomes normal. After the first dose of antivenom, the initial dose should be repeated 6 hours later if the blood remains incoagulable, or 1 hour later if spontaneous systemic bleeding continues, or neurotoxic, or if the patient condition getting worse, when there is development of compartment syndromes like that, if there is a development of respiratory complications, cardiovascular complications, you can give it even at the with a gap of even 1 hour. You must keep giving them till that process gets stopped. If the patient is stable and only if the blood clotting test is incoagulable, then you have to give for every 6 hours. After the initial response to antivenom, signs of systemic environment may recur, sometimes within 24 to 48 hours. And the dosages I already mentioned. Immediate administration of 5 vials and recent ones of 4 to 6 vials in the case of whatever maybe. You remember that it have to give in 5 ml per kg body weight. You have to give that, and depending upon the vial, you can give that dose. But you remember that the 5 ml per kg diluted in isotonic fluid. You can say that usually it occurs in 10 to 20 vials. It comes as. So if any question is asked, you can say that 10 to 20 vials will be given for one dose. It's like that. Usually we give 10 vials. And sometimes the reactions occur as with the other drugs. So what are the early anaphylactic reactions? It can occur in 1 to 180 minutes, that is up to 3 hours after starting antivenom. The patient begins to itch scalp. As you know, what are the anaphylactic reactions? Patient may develop urticaria, dry cough, fever, nausea for anti-snake venom as well. Sometimes patient can develop angioedema. Then you have to give epinephrine. Is given intramuscularly, as you already know. Initial dose of 0.5 mg for adults. The dose can be repeated every 5 to 10 minutes if the reaction persists. And the what are its reactions, endotoxic reactions? Sometimes it involves rigors, fever, vacillation, hypotension. These are it takes time. If those things happen, you have to give the intravenous fluids to correct the hypovolemia. These are the late reactions. Usually these things won't occur, but it can be dealt accordingly. But you have to remember the anaphylactic reactions and treatment. is there any role of prophylactic? That means there are no symptoms, but can we give ASV, prophylactically? I mean, if there is any suspicion of bite. Based on results of powerful and well-designed trial in Sri Lanka, routine use of prophylactic adrenaline is recommended before antivenom treatment, except in those older patients. If it is given, adrenaline has to be given, can be given first to prevent the reactions. That's what it is. And here, the epinephrine can be given in a 0.5 ml of 0.1 solution. But it is advisable to keep the epinephrine with you while giving the ASV, and if any reaction occurs, then immediately give epinephrine. That's a better approach. Usually, what are the things that's going to happen after giving ASV? Usually, there is rapid decrease in generalized malaise. The patient usually gets better. The patient seems to get better. Usually, his consciousness improves and all that. There is a cessation of spontaneous systemic bleeding in 15 to 30 minutes. It has to stop. If you got to know that ASV is working or not, you have to see if there is any spontaneous systemic bleeding. It stops within 15 to 30 minutes. Reversal of postsynaptic neurotoxicity. Usually in cobra bite there is neurotoxicity, and it's going to reverse in 30 minutes if we give anti-snake venom. Normalization of blood pressure in shock patients. If the patient is shocked, these are the things that's going to happen. Hemolysis also gets stopped after giving anti-snake venom. This is very important complication of a snake bite. You must remember at the local site that the compartment syndrome. Usually that limb gets tight and the pressure in the limb gets too much, that it causes a pressure on the other vessels, other blood vessels in that area, and it leads to gangrene. So you must immediately do the fasciotomy, that give a cut on that part of the skin, and you have to pressure, or else it might lead to even amputation. It's a very important complication that you must remember. It's often misdiagnosed in fasciotic performed unnecessarily, since classical sense of compartment syndrome, pain, pallor, pulses, and difficulty assessing snake bite. Right measurement of intracompartmental pressure is mandatory, but usually in hospitals you don't find them. Criteria for fasciotomy in snake bite patients: if the intracompartmental pressure is more than 40 mm of Hg, or if there is any clinical evidence of intracompartmental syndrome. Clinical evidence means the color of that thing changes. There can be a bluish discoloration because of the stasis of the blood, so on. What are the hemostatic abnormalities? Strict bed rest to avoid even minor trauma, including intramuscular transfusion of the clotting factors and platelets, ideally fresh frozen plasma, platelet with platelet concentrates. If they're not available, FFP can be fresh frozen plasma can be given if it is absolutely necessary. There is a transfusion of the clotting. Those clotting factors or platelets have to be given accordingly. The indications for these blood components are the same as those of antivenom administration for bleeding tendency. As I said, for the shock and myocardial damage, you have to give the fluids, and you have to keep checking the central venous pressure. Sometimes if the patient is is in shock for a long time, then you have to give the inotropic support. That is, you have to give adrenaline, dopamine or dobutamine to maintain the blood pressure. Trial of anticholinergics, which is not that important for you. Sometimes in neurotoxic envenomation, the patients need to get intubated. That means endotracheal intubation can also occur because of the respiratory arrest. And this is a symptomatic treatment, depending upon how the patient presents to you. If he's not, if he's breathless and if he's not maintaining the oxygen saturations, that you have to intubate. And this is also the AK management. As I already said, these are not of much important to you. You have to remember the ASV and how to give the ASV, what are the complications affecting ASV, and how to, sometimes we end up even in dialysis because of the AK. Dialysis sometimes has to be done to the patients because of the venom that is present in the blood, leading to AK. Then there is oliguria. Then you have to take the venom out of that blood. So dialysis is also very useful sometimes when then the other things doesn't get when the patient is not recovering and the patient's urine output is not increasing. The dialysis is very useful. as I already said, the hypovolemia, the patient, you have to keep giving the fluids to the patient to maintain the hydration, and also to prevent the patients from landing in the acute kidney, that is renal failure. If there is any severe acidosis, give the bicarbonate. And before going to discharge the patient, then uh, advise the patient that to take rest and the rehabilitation, and again the follow-up after 1 to 2 weeks if there is any compartment syndromes and all types of like that. And sometimes that can be late manifestations of ASV as well. So ask them to come for checkup again. Thank you. And what's important for you in this topic is just go through what are the important clinical symptoms of the snake bite locally and systemically. Systemic, as I already said, cardiovascular, neurological, eye, and the kidney things. These are four most important things you must mention if the question is given. And accordingly, the ASV must be given. How the dose you must also write the dose in final year MBBS examinations if it is given, or sometimes it can be asked even in uh, you know Viva. So it is very important questions, because from toxicology or from the bites, one question will be definitely given to you, and if you go through them, it will be of very useful. And thank you, thank you.